Welcome to today's video, where we're diving deep into a critical issue affecting Canadians across the country, the healthcare crisis, particularly the increasing wait times for medical procedures and emergency care. Over the last few years, the situation has only worsened, and now more than ever, Canadians are struggling to get the care they need when they need it. Let's break down the numbers and discuss the causes, consequences, and what the government is doing or isn't doing to address these challenges. According to the Canadian Institute for Health Information, the median wait time for an MRI scan in 2023 is a staggering 11 weeks. That's nearly 3 months of waiting for a crucial diagnostic procedure. For CT scans, the median wait time has increased to 5 weeks, a delay that can have serious consequences for patients awaiting a diagnosis. The hospitals with some of the longest wait times include Toronto General Hospital, Montreal General, and Vancouver General Hospital, where delays for both emergency room care and diagnostic imaging services have reached record highs. For example, in Ontario, the average wait time for a non-urgent MRI is over 90 days, while in Quebec, patients often face similar delays for imaging and surgical services. While diagnostic imaging delays are problematic, the situation is even worse in Canada's emergency rooms. In Ontario, patients are spending an average of 20.7 hours waiting to be admitted after being seen in the ER. In some hospitals, like Ottawa General, the wait can exceed 24 hours during peak times. In British Columbia, the average wait time is around 10 hours, but certain regions report waits upwards of 15 hours. This isn't just an inconvenience, it's a matter of life and death for some patients, especially those experiencing heart attacks, strokes, or other time-sensitive conditions. So, what's causing this healthcare crisis? One major issue is a severe shortage of healthcare workers. Many hospitals, especially in rural areas, are struggling to staff enough nurses, doctors, and technicians. This shortage has only been exacerbated by the COVID-19 pandemic, which left many healthcare workers burnt out, leading to higher than usual attrition rates. In fact, studies show that there are nearly 25,000 healthcare vacancies across the country, with nursing shortages being one of the biggest challenges. The lack of personnel has a direct impact on how quickly patients are treated, especially for non-urgent procedures and in emergency departments. To address this crisis, the Canadian government has taken several steps, though many argue that these efforts are insufficient. Prime Minister Justin Trudeau's administration has announced plans to allocate $2 billion to help reduce backlogs in surgeries and diagnostic imaging. Provinces like Ontario have also pledged to increase healthcare spending, with Ontario Health promising to open additional MRI machines and CT scanners to address the increasing wait times. However, many experts warn that simply increasing funding won't solve the problem. The root cause lies in the system's inefficiency and the lack of long-term planning. Dr. Andrew Boozary, a public health expert, argues that we need to focus on training and retaining healthcare workers, especially in remote and rural areas that are experiencing the worst of the shortage. More than 5 million Canadians are currently facing delayed medical procedures, whether it's for surgery, diagnostic imaging, or other treatments. One of the most troubling statistics is that many cancer patients are being forced to wait longer for diagnostic imaging, which can mean delayed treatments and worse outcomes. The median wait time for prostate cancer surgery, for instance, has increased by 11 days compared to 2019. While that might not sound like a lot, when dealing with aggressive forms of cancer, every day counts. While government efforts are helping to alleviate some of the pressure, many healthcare professionals and patient advocates say it's not enough. Patients like Sarah Jenkins, who waited over 8 hours in an ER with a broken arm, are just one of many examples of how the system is failing. Advocates are calling for systemic changes, including improving telemedicine options, increasing nurse training programs, and investing in preventive care to reduce the burden on hospitals. Telemedicine and virtual appointments have helped alleviate some pressure by reducing in-person visits for minor issues. But the reality is that many Canadians, especially in rural areas, still struggle with access to technology and high-speed internet. So, what can you do as a Canadian facing these long wait times? First, explore alternative care options like walk-in clinics and telemedicine services, especially for non-urgent concerns. Additionally, being proactive about scheduling your appointments, whether it's for an MRI or surgery, can help ensure you're not caught in the backlog. But it's also important to stay informed and advocate for better healthcare policies. By pushing for long-term solutions, we can ensure that Canada's healthcare system remains sustainable and continues to provide high-quality care for future generations. Thank you for watching, and if you've experienced long wait times or have thoughts on how to improve the healthcare system, please share your comments below. Don't forget to like, subscribe, and hit the notification bell for more updates on pressing Canadian issues.